Hello, everyone. Welcome to the Newsbrowse News broadcast. According to Al Jazeera, Gaza's health ministry has accused Israel of preventing more than 16,500 Palestinians who require urgent medical treatment abroad from leaving the war-torn enclave. The ministry warned that patients are dying due to these exit delays, even though a nominal ceasefire has been in place since October of last year. Local health officials state that Israel is strictly limiting the number of people allowed to leave for medical purposes, operating the Rafah crossing only 3 days a week and the Karam Abu Salem crossing just 1 day a week for medical evacuations. This bottleneck is severely worsening the humanitarian crisis in Gaza, where nearly 90% of the population is displaced and facing severe food insecurity. UN Secretary-General Antonio Guterres has urged Israel to immediately and unconditionally reopen all border crossings to facilitate the entry of humanitarian aid and the safe evacuation of patients. Reconstruction of Gaza's heavily destroyed healthcare infrastructure is estimated to cost billions of dollars, but blockades and ongoing military activity continue to hinder any recovery efforts. According to UPI, the European Commission has ordered tech giant Meta to restore free access to its messaging platform WhatsApp for competing artificial intelligence assistants. This interim order is part of an ongoing antitrust investigation into the company, which began in December following complaints from European competitors and Italy's antitrust authority. Meta had blocked free access to WhatsApp in October and later introduced fees in March, a move regulators say could cause irreparable harm to the growing AI assistant market. The European Commission stated that these temporary measures are necessary to safeguard competition and preserve WhatsApp as a key entry point for European consumers to reach AI services. Meta has expressed strong opposition to the decision, calling it regulatory overreach and announcing plans to appeal the order, while arguing that its WhatsApp business platform was not designed to host rival chatbots. If Meta fails to comply with the directive, the company could face severe financial penalties, including fines of up to 10% of its total global annual revenue. According to a report by UPI, international fashion, luxury, and sports brands are rapidly expanding their presence in Argentina after years of absence. This resurgence of interest follows market opening measures and looser import restrictions introduced under President Javier Milei. Despite a challenging domestic economy where overall mass-market consumer sales have declined, foreign companies view Argentina as a lucrative long-term opportunity. Economists note that these global brands are specifically targeting high-income consumers, representing the top 10% to 20% of earners, who remain resilient to inflation and economic hardships. In response to this influx, major shopping mall operators in the country are launching multi-million-dollar expansion projects. For example, Chilean retailer Cencosud plans to invest $60 million to expand Argentina's largest mall, Unicenter, adding dozens of new stores by 2027. Similarly, Arsa, the nation's largest mall operator, is moving forward with 3 new retail developments. Industry experts believe the arrival of brands like Mango, Skechers, and Dolce & Gabbana could foster healthy market competition, potentially driving down historically high clothing prices in the region. According to a report by RNZ, Samoa's National Hospital is rationing critical medicines due to an ongoing severe shortage. Key medications in low supply include metformin for managing type 2 diabetes, amlodipine for high blood pressure, and children's paracetamol. To address the immediate crisis, Fiji-based Pacific Specialist Healthcare, PSH, sent an urgent air freight shipment of pharmaceuticals last week. However, this delivery covers only about half of what the hospital currently requires, with the remaining supplies expected to arrive in the coming weeks. Local media reports indicate that a backlog of approximately 12 million Samoan tala, sat $12 million, in unpaid supplier bills has contributed to the supply issues. Samoa Medical Association President Sayuli Dr. George Tuitama stated that the shortage has also severely impacted the mental health unit, forcing medical staff to ration psychiatric drugs by personally delivering daily doses to patients' homes. The critical shortage of medicine was highlighted as a major barrier to effective medical care during the association's annual general meeting. According to a report by CBS News, Taliban security forces in Afghanistan's western Herat province opened fire on a rare public protest on Tuesday, killing at least one woman and a child and injuring more than a dozen others. The demonstration was sparked by the Taliban Morality Police's recent detention of approximately 30 women and girls for alleged violations of the regime's strict Islamic dress code, which requires women to cover their hair and faces. Defying a history of violent crackdowns, men and women gathered to demand work, education, and freedom, with some protesters throwing stones in retaliation as security personnel fired directly into the crowd. Local medical sources confirmed treating multiple patients with gunshot wounds, while United Nations officials, including Special Rapporteur Richard Bennett, condemned the excessive use of force and called for accountability. Local Taliban authorities denied that any civilians were injured by police gunfire. The head of the Morality Police in Herat went further to deny that any arrest had taken place, falsely claiming that all women in the province strictly adhere to the dress code. That's all for this video. Thank you for watching. See you in the next video.